Health insurance helps pay for some of your healthcare expenses. You pay for some, and the insurance company pays for some. Cost sharing is different for every type of plan. All plans have a limit to how much you pay per year called your out-of-pocket maximum. So let's look at how it works with a popular type, a high deductible plan. Our friend Chris is going to demonstrate how cost sharing works with this type of health insurance plan. The costs and figures you'll see are for example only and may vary. With a high deductible plan, the first phase is the deductible phase. You pay the entire cost of your care until you meet your deductible. Next is the coinsurance phase, where Chris pays a percentage and the insurance company pays a significant portion. Every dollar Chris pays for healthcare gets her closer to her out-of-pocket maximum for the year, which is $5,000. When she gets there, insurance pays her costs in full. High deductible plans can be paired with a tax-free health savings account or HSA you can use to pay your portion of the costs. And this type of health insurance plan covers preventive care at no cost. Okay, Chris, it's time to go to the doctor and use your high deductible health coverage. Chris visits the doctor who orders lab work, tests, and a generic prescription medication, which has a set rate of $5. The total cost is $1,805. Since her deductible is $2,500, Chris pays the full amount, but all of her costs get her closer to the out-of-pocket maximum. She can pay those costs from her HSA. Let's see what happens on her next visits. On Chris's second visit, the total cost is $450. She still hasn't met her deductible, but she's getting close. The third time Chris sees the doctor, the charge is another $450. But Chris won't pay the full amount because with this visit, she meets her deductible. Let's look at what happens as she moves into the cost-sharing phase. Chris still has $245 to pay to meet her deductible, so she's responsible for that. Now there's $205 remaining, and that amount is eligible for cost sharing. Chris's portion from here on out is 10%, or $20.50. We'll use $21 for easier math. On the fourth visit, now that she's in the coinsurance phase, she pays just 10% of the costs, or $45. But remember, her last visit requires more tests and another prescription. Chris's portion is 10%, or $135 of the tests and $5 on the generic medication. The lab work fees contribute to her deductible and out-of-pocket maximum. The set fee for prescriptions only goes toward her out-of-pocket maximum. If Chris had no insurance, her costs for the year would have been $4,821. The high deductible plan brought her out-of-pocket costs down to $2,706. When you're price comparing health insurance plans, you'll not only want to weigh your out-of-pocket costs, you'll want to consider the cost of the plan's monthly premium and potential tax savings for using an HSA. There's a plan that's right for your lifestyle and budget. If you're ready to find out which one fits you, contact a Blue Cross Blue Shield of North Dakota representative or get started online.